we have what we call smoking. So people who have been smoking for long also have increased risk of getting diabetes. At the same time, major complications or chronic complications of diabetes, and as well, smoking worsens the diabetes if you're doing a smoking. Hi everyone, I welcome you back to yet another episode to Dr. Star. And today we have what we call primary care in diabetes. Now, this is exactly the point I wanted to bring in this very lecture, is that people have moved away from diagnosing this diabetes and leaving it for especially the specialists. And yet it is our care as general practitioners or every health practitioner to diagnose this diabetes, and eventually you start medications on these people. Then maybe as complications pile up or as the diabetes gets complicated, that's when maybe our specialists should come in. Now we have what we call 8 care processes that we use in management of these diabetics. And these 8 care processes in diabetes, we actually add another one called retinopathy on these 8 care processes. So the first one is why these care processes? Because these ones, when we screen them, these patients, when they come occasionally, even for any other condition, and then as a general practitioner, you know the rate at which diabetes is increasing in the country or worldwide, and you know this patient lies actually within the age bracket of people who are supposed to be screened, and you at the back of your head you know these 8 care processes, then it will be very simple to diagnose diabetes at a very early stage, and then also to do the management that will eventually later not to be complicated ahead. So these 8 care processes include, one is the HbA1c. So every patient who comes in and is above the 40 years or 35 years we've talked about with the signs typically relating to diabetes, you must do an HbA1c. So the HbA1c will actually tell you for the last 2 to 3 months or a year, this patient has not been knowing that they have diabetes. So how is their diabetes controlled, or how is their body moving towards the diabetes? So you do that HbA1c as one of the 8 care processes. Then 2 is BP monitoring. So you must be monitoring the blood pressure for every patient who comes in and is above 35 years, because high blood pressure, or what we call hypertension, and then added to diabetes, added to obesity, added to hypercholesterolemia, it will later on lead into cardiovascular events. So one of the things, diabetes and hypertension, they are always going together. Some people say they are each. So another process is another care process is the BMI. So the BMI is called body mass index. That's why when you go to the facility and you're above 35 years, they will take your weight and sometimes your height. So we use those 2 parameters to measure your BMI. BMI is, we want to know how heavy you are, and the heaviness is usually correlated to the excess fat tissue that you have in your skin or in your body. And so the BMI will typically relate to our way of diagnosing this diabetes, and later on in its management, as we shall see down there. So the BMI is always taken, and the normal should be less than actually 30, but if you are above 30, then that means that you're going to have issues with your weight, and also later on diabetes. So another care process is what we call lipids. So lipids, every time you come also you're above the same age bracket, they do your lipids. Lipids are like fats. And when we do your lipids, there is a way also how they are correlated to the diabetes, like we shall tell you, or what we call atherosclerotic conditions, vascular conditions. So we shall also tell you how lipids relate to the diabetes. Then as well, we have what we call smoking. So people who have been smoking for long also have increased risk of getting diabetes, at the same time major complications or chronic complications of diabetes, and as well smoking worsens the diabetes if you're doing the smoking. And another parameters they are doing is checking the feet. Checking your feet will also help us to tell the complications of diabetes. So that's why every time you go to the facility and they are checking for diabetes as well, they will examine your feet so that they can see if the diabetes you have been diagnosed with has actually caused even some of the complications that affect the feet. And then another one is what we call urea and electrolytes. These are like minerals that are always regulated by the kidney. So as we are checking them and they are in abnormal levels, we are actually also seeing how your kidney is performing in relation to the diabetes. Then as well, there is what we call urine. We usually take your urine, and there is what we call urine albumin creatinine ratio. But that is measuring amount of the protein you have in urine. In normal cases, you're not supposed to be having protein in urine. But you find when you're diabetic, the diabetes has maybe gone into the stages and then affected your kidney. And then you find your kidney is not filtering out the way it's supposed to filter. So protein leaks in the urine, and the major protein that leaks is called albumin. So it's not supposed to be leaking through the kidneys, and then we find it in urine. So that's one of the markers that you really have the kidney failure, maybe due to the diabetes you have been having that is long standing. So another thing they check is your eyes. So they usually do the screening on your eyes. Diabetes affects the eyes and causes blindness. So if you see a doctor also checking your eyes, he wants to check if you have diabetic retinopathy or your vision is affected by this diabetes. So that is one of the complications that you get if you have the diabetes. And that's why we do also regular checkups on the kidney. So the 8 care processes, like I've said, your eyes, your feet, your kidneys, as well as your body mass index or your weight, then plus your blood pressure. And also for the average of the average glucose levels in the last 3 or 4 months. That is doing the HbA1c. So you might also ask, why these 8 care processes? Why am I doing them? Is that studies have shown that these 8 care processes, if they are really followed or put in practice, then they are reduced risks of having reduced risks of major complications, like we've said, sight loss. We've said feet complications such as neuropathies, or you find your leg is being cut or amputated because of the major complications of the diabetes it has on the vessels, the peripheral artery disease. So all those conditions, or the neuropathies, and later on your nerves become dead, and then you later on have to amputate your leg or to remove your leg. All those are chronic complications of diabetes, of which should be screened later on, and then timely intervention is done, and then you end up not having such comorbidities later on. Cardiovascular events, you hear someone has died of a heart attack, someone has died of a myocardial infarction or a stroke. So those ischemic events, all those are complications of diabetes. But once diagnosed, all 8 care processes are being utilized, then you find you're aware of those complications, or timely intervention has been done, or timely referring to a specialist for these complications. But as well, you might think that it is an easy process. We still have a diagnosis gap, or in these care processes. First of all, you find some facilities still don't have the kits, maybe to do the HbA1c. They still rely on the blood glucose levels and using this fingerprint. Then we still have gaps in the knowledge, especially for our healthcare professionals, on how to utilize these resources and diagnose this diabetes early enough. We still have a gap in areas being deprived. Because you might think of HB1s and you think maybe this is done only in Kampala or in Barara, and then you find in the villages these things are not there. So there is that gap. So linking that gap of the resources towards these 8 care processes is also causing some issues, maybe in late diagnosis of this diabetes, and you find it is already in complicated stages.